Turning now to a very important story about healthcare costs and how two similar surgeries ended up with two very different bills for one Seattle man. His name is Ely Bair. He had related jaw surgeries at the same hospital under the same insurance provider. Now, Bair thought that would mean similar medical costs, but he was oh so wrong. His bill for the second procedure was nearly, listen to this, 10 times higher. Yep, 10 times. We're looking at the story as part of our continuing Bill of the Month partnership with Kaiser Health News and NPR.
I had migraines, I would say, almost weekly.
Ely Bair had severe jaw pain until he underwent a two-part surgery to realign his mouth palate. He had Premera health insurance through his job that covered most of the first surgery on his upper jaw in 2018, and he paid $3,000 out of pocket. Bair switched jobs before his second surgery on his lower jaw in 2020, but still had Premera health insurance and did the procedure at the same hospital.
After the second surgery, that really fixed everything. My migraines were gone.
And then the bills came. This time, Bair's out-of-pocket expenses totaled more than $27,000. He learned that having the same insurance provider did not mean the same coverage when he changed jobs. And his new plan had a $5,000 lifetime limit policy for jaw surgery.
I was speechless because I had never heard of that. I had a little mini breakdown. The amount was pretty devastating.
After Bair filed a complaint with the state attorney general's office, the hospital lowered his bill to about $7,000. Bair is now paying that balance, but he feels blindsided.
I feel like I have a lot of distrust in hospitals and the insurance industry. I just feel like the process is too confusing and, could wind up devastating if you get a surprise bill.
Now, Premera Insurance did not respond to our request for comment, but in a statement to Kaiser Health News, it said this, that the plan details are available online, and it highly recommends members to contact them to verify the benefits. The Swedish hospital told CBS News that Bair was billed for the care that he received. However, the surgeon advocated to get the bill lowered since the patient and the provider were not aware of the lifetime limit before his surgery. Joining us now is Dr. Elisabeth Rosenthal. She's the editor-in-chief of Kaiser Health News. Good to see you, Dr. Rosenthal. Can you explain this insurance policy issue that Ely was relying on?
Oh, yeah. One of the wonderful things the Affordable Care Act did was to impose lifetime limits in 10 essential categories. But jaw surgery is not one of them, and it's in this gray area between health insurance and medical insurance. And that's where Ely got trapped. The other thing is so many of us assume that when we see the same name on our insurance card, the policies will work the same, but what benefits you get from any one insurance depends largely on what your employer decides to give you. So in switching employers, he had the same looking insurance card, but the benefits were hugely different.
It always seems so complicated to me, Liz. So what can people do before and after the surgery to avoid this happening to them? Or is there anything you can do? Are you frozen?
Oh, she lost her.
Oh, well, I think one thing that's really important for people...
Go ahead.
One thing that's really important for people to know is, if you ask your doctor, is this going to be covered? They want it to be covered, so they're going to say, sure, it should be covered by your insurance. But as Ely discovered, this was on an 80-page booklet, so his doctor didn't know. So it's really important to contact your insurer to verify those benefits. The second thing is if you don't get redress and you get this surprise bill, good for Ely. Go to your state attorney general or your state consumer protection board. They may be able to help, and your doctor may be able to help. Patients and doctors shouldn't have to read 80-page booklets in the fine print to know if their essential surgery is going to be covered or not.
Dr. Elisabeth Rosenthal, those 80-page booklets will get you every single time. I don't know anybody who's reading that stuff. Thank you, though. Thank you very much, even though I know we should. Thank you.